continuation of a very important National Institutes of Health project that has been homed at Southern Miss since 2001. It is the Mississippi INBRE. INBRE stands for Idea Network for Biomedical Research Excellence. And we have some nested alphabet here. IDEA is the NIH program called the Institutional Development Award Program. So NIH provides IDEA with money to provide a program called INBRE to the state of Mississippi, which runs through University of Southern Mississippi. It's a statewide program. It was first funded in 2001. Since that time, it has brought over $70 million to USM. As part of this program, it's not a normal research program. There's a lot of research involved, but it also has a tremendous impact on other schools in the state. It reaches out to 30 colleges, universities, and community colleges in the state. In the last 6 years long, Mississippi INBRE has trained around 600 undergraduate students in biomedical research, and they went on to either graduate or professional schools in biomedical sciences, and it trains about 100 students each year, which is a great number for a state our size. INBRE has created 37 research labs, primarily at undergraduate institutions such as Alcorn State University, Delta State University, Millsaps College, Mississippi University for Women, and Tugelo College. And these are labs that would not be there if we had to depend completely on state funding. So this is a very big impact for the state of Mississippi. I am very proud and happy of the outreach that the program brings to the state of Mississippi. And I am now going to introduce Dr. June Gibson, who is the Community Outreach Director for the program, and also President and CEO of My Brother's Keeper. Dr. Gibson.
Thank you. I'm honored to be here today to celebrate University of Southern Mississippi's INBRE grant. In 2013, My Brother's Keeper partnered with the INBRE to create a new pathway for students. We wanted to ensure that the students were able to be collected and understand what has to happen in the state of Mississippi. We wanted well-rounded, solution-oriented students. And from this proposal, we developed the service scholars. And the service scholars have been trained to understand that regardless of the labs, regardless of the research and the data, that there's another person on the other end of that. And that person may suffer from lack of access, the person may suffer from food insecurities, but most importantly, the person needed solutions. And through this partnership, I'm proud to say that we have trained throughout 5 years of summers, approximately 30 students a year, over 100 students to expand their career aspirations, to be able to move into public health, to understand the principles of public health and how those things intersect with biomedical research. These efforts have changed how healthcare is actually provided in the state of Mississippi. It's changed us as a community-based organization who's now able to provide more access to communities that before were completely left out, completely left behind in healthcare in Mississippi. I'm proud of this relationship. I look forward to many more years. And now I introduce the man who made it all happen, the visionary behind all of this, Dr. Muhammad El-Ajri. Dr. Muhammad El-Ajri is the director of the Mississippi INBRE and professor and associate dean for research and graduate affairs.
Thank you, Dr. Cannon. Thank you, Dr. Gibson. I just want to give you like an overview of what this program does and how important it is for our state. And then I'm happy to answer the questions you have afterwards. And so again, the mission of our program is to increase the capacity for biomedical research in the whole state. As you know, we have a lot of health issues as a state, and NIH found that it is important that we inject some resources into the state to improve the capacity to do research in various biomedical fields. And so we do this with three different ways. The main one is that in order for us to compete as a state and improve our research capacities, we need more research laboratories. And what we have done as a program is we have built new research labs throughout the state. These are labs that started basically from nothing. We have renovated space. We have funded investigators and students to do biomedical research. And these labs have been so productive to now they're bringing in extramural funding that otherwise would not have happened. So we're very proud of that. The second main component of INBRE is training the Mississippi workforce. And the idea is that as a state, if we want to compete in the future and improve things, we have to basically grow our own. And we have a lot of bright students throughout the state that basically did not have access to research. This is a lot of schools like undergraduate institutions. For example, here at USM, we have a strong research component. A lot of our USM students can go into a research lab, learn how to do research, and then become either doctors or researchers down the road. But there are a lot more students outside in Mississippi who don't have access to that. And so the idea is we're gonna reach out to as many students throughout the state to ensure that they have an opportunity to do research and hopefully become researchers. And sure enough, we have been able to train over 100 students every year, and training has been very intensive. Most of these students have changed their career paths to where they want to become biomedical researchers or physicians or involved in biomedical research. So again, these are Mississippi students that we plan that they will get more training and hopefully come back to the state and establish their own research laboratories and care about the health issues that we deal with as a state. And then a third component, which Dr. June Gibson mentioned briefly, is community engagement. And so we have found in the last few years that it's not enough to train students on just research in the laboratory, that there's a whole component in health that it has been basically underserved, and that is training students to actually work with the community and go into specifically underserved communities in Mississippi and teach them how to interact with them in a public health setting. And we have done that. We have trained a lot of students. They're very excited about working with patients and especially addressing the health disparities that we have in the state. And so we're very proud of that component too. And so obviously this is, I feel like we've had great success in the last 5 years. NIH agreed with us, and they liked our plan for the next 5 years because we've added some new exciting things. And so again, we're very happy about that. And again, USM has been tremendous in supporting this program. As Dr. Cannon mentioned, it is led here from USM, and it really could not have happened without the support of the university. And Dr. Cannon has been an unwavering supporter of the program. And with that, and also one more thing, this is a really large program, and it involves a lot of people. Some of them are here at this press conference, some of them could not be with us, but it's really a team effort. And we have a lot of scientists, a lot of researchers throughout the state that basically make this happen. So I wanna thank them all and appreciate their efforts. And with that, I'm happy to answer any questions.